Good morning, good afternoon, and good evening, everyone. We are very happy to welcome you all today for the launch of the WHO, UNICEF, and the Japan International Cooperation Agency JICA guide on strengthening implementation of home-based records for maternal, newborn, and child health. This webinar will be in French, in both French and English. Ce webinaire est en français et en anglais. Pour écouter en français, cliquez sur Interprétation et sélectionnez Français. Pour n'entendre que le français, cliquez sur Couper le son d'origine. It is my pleasure now to hand it over to Annie Portella from the Department of Maternal, Newborn, Child and Adolescent Health and Aging, WHO Geneva, to take us through the session. And here's Annie.
Thank you so much, Tala. Good morning, good afternoon, good evening, colleagues. We're really happy that you can join us for this launching. I have here on the slide the agenda. We have a lot we want to share with you, so I'm going to try and speak slowly. I'll let you read the agenda and get started. First part of this session, I'd like to present, first of all, who's going to present today, and it's myself. My colleague Laura Nick-Laughlin from WHO IVB. We have Anne Detchin from UNICEF New York and Keiko Osaki from JICA. So I just wanted to start off, if you can give me a show of your thumbs up. Does everyone on the line know what a home-based record is? I'm assuming yes. Held in the household, a record of health visits held in the household by the woman or the parents, meant to complement information maintained at a health facility. And as you know, there are many different types in different countries. They range from either just an antenatal care note, vaccination only card, a child health book, or an integrated maternal and child health book. And now I'm going to hand over Laura to take us through some important information about home-based records.
Thank you, Annie, and hello, everybody. So I'm going to run through what we have been doing related to home-based records. And I think an important piece of work that was published in 2018 that was carried out with the WHO Departments of Maternal, Newborn, Child and Adolescent Health and Aging, Immunization and Reproductive Health and Research. A guideline document was published looking at recommendations on home-based records for maternal, newborn and child health. Next slide. And as part of this recommendation, or these guidelines, two recommendations were made. And the first one found that the use of home-based records as a complement to health facility records is recommended for care of pregnant women, newborn mothers and children to improve care-seeking behaviours, men's involvement and support in the household, maternal and child health care practices, infant and child feeding, and communication between health workers and women parents and caregivers. However, a low certainty of evidence was found for this recommendation. When it comes to the second recommendation, it was found that there was insufficient evidence available to determine if any specific type, format, or design of home-based records is more effective. So it was recommended that policymakers should involve stakeholders to discuss the important considerations with respect to the type, content, and implementation of home-based records. As Annie mentioned at the beginning, depending on your country context, there are many different types of home-based records. So this is why having good policymaker involvement and in that, of course, of stakeholders can improve the home-based record. Next slide. As we know, unfortunately, countries often face implementation problems related to home-based records that can hinder successful implementation. And from what we know is that these challenges can include frequent stockouts, whereby either at the national level or at the health facility level, there are no home-based records available. Oftentimes there are poor quality home-based records. This could be due to the type of quality in which they're printed on. Another issue can often be that health workers are not filling out the home-based records correctly. And then from an inequity point of view, there are also some issues whereby if an individual has misplaced a home-based record, when they come to the health facility, they may be requested to pay for the replacement, or sometimes people are denied access to services. So the equity aspect of the home-based record is really critical, because we want to ensure that everyone has access to healthcare, and that by not having a home-based record doesn't impede that. Next slide. So on the discussion of stockouts, WHO and UNICEF have a joint reporting form that we collect immunization related indicators annually. And we request that countries provide this information, and we have some indicators related to home-based records. And as part of that, we request if countries report whether or not they had stock out of home-based records. And what we found is that some countries, they have recurrent issues on an annual basis where they have stock out at national level of home-based records. And in this map, the darker the blue, this is an indication of increased number of stock outs being reported through the joint reporting form. So it really begs the question, why is this happening in these countries, and what can be done to do that? And are you from a country yourself which has these issues? So in the next slide, we have a poll question, which I hope can be launched. And the question is related to, in your country, what are the main issues that you face with implementation of home-based records? So if the poll could be launched, then hopefully some of you can have access to that. And for our French Francophone speakers, the question will be added to the chat for translation. So what are the main issues in your country with implementation of home-based records? Are there frequent stockouts of home-based records? Are the home-based records of poor quality? Are the health workers using them properly or not? Do people not keep them? Retention is an issue oftentimes in many countries where people don't keep them in safe places or forget to bring them to the health facility, or the content does not meet the needs of the home-based record users. So I don't know how the poll is going, but if we give people a few moments to answer, then hopefully we can, and you can select multiple choices, because we know that these options can often happen, and there's multiple reasons. But if there's an option that is not there, please, yeah, I see people are adding other answers to the chat. But we'll give another couple of seconds. I don't know, Tala, how many responses have we received so far?
We have received a good number of responses. I'll just wait a few seconds and then launch the results.
Great. And I'm seeing some people are saying that they haven't implemented home-based records yet in their country. So this is where sometimes the definition is often important, because it can mean many things, a home-based record, as Annie mentioned at the beginning. Okay, so right, so what we're seeing is 40% have reported that there are frequent stockouts of home-based records, and the home-based records are poor quality. So the top three answers are that the health workers are not using them properly, there are frequent stockouts of home-based records, and also that people don't remember to bring them to the health facility. Okay, so this is this is not unexpected, but I think it is unfortunate that these are some of the challenges the country face. So in the next slide, please. So following from the recommendations, and I suppose some of the challenges that we're aware of, WHO, UNICEF and JICA work together to develop a practical guide for country program managers to strengthen implementation of home-based records for maternal, newborn and child health. And that's why we're here today. So the purpose of the guide is to support decision-making and efforts to strengthen home-based record implementation through processes for planning, design, implementation and monitoring, and address challenges related to home-based record, as some of the challenges that we just mentioned in the poll. So the primary audience for this guidance document is program managers, both at national and subnational level, who are leading or key contributors to planning and implementation of home-based records. And when we say program managers, we mean all program managers that have content that are important to them and they want in the home-based record. And I think that's one of the key aspects of this guide, is we want to have a core team or a group of people that get together to make these decisions. The secondary audience, of course, are the stakeholders in home-based record processes, who may have various information and tools and resources throughout the guide that will be valuable to them. So on the next slide, we're going to discuss some of the methods, but I'm just going to point out just briefly, because there's a lot of text on the slide, but just to say that this development process began in 2019, if I'm not correct. And so it's been quite a journey. And I think given the fact that also as part of, during the COVID-19 pandemic, we were able to do this remotely, we haven't done that before. But I think prior to development of this guide, a mapping exercise was conducted to identify and collect existing tools from partners that support the use and implementation of home-based records. I think the real key idea behind this guide was to build on existing evidence and develop this in parallel and in collaboration with other partners who work in this area. And one key aspect, I suppose, was that 2 consultations were held with external partners, including representatives of ministries of health in 2 countries, and WHO UNICEF staff from country and regional offices were there. So this was done in Nepal and Ghana in 2022. So in the next slide, I suppose the concept behind the guide is to follow this planning cycle, program management cycle. So that's from planning and situation analysis, to content selection and design. I think the situation analysis is in the core center, because this can be a very important aspect related to planning, where countries may not have all available evidence to plan, but when they sit down and do a situation analysis, this is an opportunity to kind of reflect on how the home-based record is performing in the country or not. And then following up on that, there can be discussions around content selection and design, and then on to implementation and monitoring. So these are common elements that appear across all chapters. So this really kind of helps to have reflections and considerations throughout the guide. Next slide. Yes, and I think one of the key concepts of this guide is the user-centered approach. I think we really need to consider when we're developing these guidance that how can this meet the needs of not only people at national level who are planning things, but also the end users. So the women, parents and caregivers, the health workers and the program managers. And this really is something that we wanted to ensure that we could incorporate throughout the guide and ensure that that was also reflected and information could be put through and into the program management cycle, so that we consider the end user and how this can apply to them. Next slide. So the guide is structured into 7 chapters. So the outline of the guide is introduction, then we go into the planning for successful implementation of the home-based record. Following on from that is how to conduct a situation analysis, and then selecting content, revising and testing the design of the home-based record, which is very important because that will allow you to understand whether or not the guide is going to be applicable for the users. Then we have a chapter on implementing the home-based record, and finally monitoring implementation of the home-based record. Next slide. And how can the guide be used? I think this is a very novel approach where we looked at how we can have different activities and templates within the guide that can be used as a reference to kind of help discussion and center discussions around how to improve certain aspects of the home-based record. So these activities help you to have a toolkit approach whereby they can be adapted to local contexts. And the guide includes many country examples and links to existing tools and resources, which can be very helpful, because oftentimes getting the discussions started at country level, it's good to have some structure. And I think these tools and templates really can be very beneficial when all the programs are together. Next slide. And then throughout the guide, there are 8 success factors to achieve optimal use and performance of the home-based record. And I think these 8 success factors are really important, and the attention to these is key throughout the management cycle, program management cycle, because it will help track progress in home-based record implementation and can also result in optimal use and performance of the home-based record. So these 8 success factors are high-level support, coordination mechanism, home-based record content, printing and distribution aspect, as well as budget and financing, and being valued by health workers as well as by women, parents and caregivers. And the monitoring aspect is also key, because by ensuring you monitor use of the home-based record, you can know whether or not it is meeting the needs both at national level, but also for the users. And more details on each of these success factors are provided throughout the guide. So with that, the next slide, I'll pass over to Annie.
Thank you, Laura. Yeah, and what we'll do now through these next set of slides is just take you briefly through highlights of some of the different chapters. And again, we're trying to entice you to go to the guide and to read it yourself and look through it and see the different templates. Now, chapter 2 is really about the planning process. And something we're going to repeat throughout the guide and that you'll see is that good planning will allow you to decide, assuming a country program manager or a district program manager or facility manager is working with his or her team, how can they define their objectives and take actions? And one of the core things is having information, and that will be essential for planning. And we know that there can be an information overload. And in this case, we're really focusing the information about how the 3 user groups, so, women and parents, health workers or program managers, how do these 3 important user group use the home-based record? And the other information that will be really important is about the performance of the operational support processes. And with this information, you would be able to make your plans. The guide, as Laura said, sorry, I'm rolling and I rolled too fast. We have examples from different countries, and we'll just go through some of them in the slides just to make it so again, you can look at them. But this is an example we have from Kenya and Nepal, where showing how different internal coordination within the ministry allowed them to deal with some of the issues. For example, in Kenya, the Ministry of Health shares tasks related to the handbook between different departments. And delegating activities to these different departments. In Nepal, the HMIS unit is really fundamental to the annual plan for printing and revising home-based records. And there's even a deadline to ensure that enough records are printed for each year, ensuring that anybody who wants to make any changes or getting your amounts in have to be done by a certain time. This makes sure that for the next year, records are available. We have some interesting activities. In this case, one related to costing. We assume there's stockouts because sometimes there's not enough budget. So how do you cost actually or plan accurately for the different activities to ensure your home-based records are available and used appropriately? We have also an interesting example from the Ministry of Health of Cameroon, which a country team had shared in a BMGF WHO Afro workshop, and how they addressed funding issues in the short term. I'm skipping chapter 3. My colleague Anna will come back to this in a moment because we're going to relate situation analysis to monitoring as well as planning. But I wanted to focus on another chapter, which we find is really important, and it's selecting content. And one of the things we've learned from countries that often country programs struggle with what content to include in the home-based record. Home-based records range from 1 page to almost 80 pages in other countries. So how do countries make that tough decision about what should be included in the record? And any content that a country does decide to include should have a clear rationale as to why it's there. It aligns with health program priorities, and it's supported by information that shows that the content is valued by the users and that it will be used correctly by the users. Here's an example from Ghana, and Catherine Aduasare from the Ghana Health Service will share some words with us at the end. But Ghana did go through this tough decision and the process of selecting content. In 2016, Ghana had 2 different home-based records, one for women and one for children. And these were combined into an MCH record book in color. So we have just a brief story about Ghana and how they managed that decision and deciding on what content to include. We've included different activities and templates to also, how can a country program manager work with his or her team to think about what content should be included. A template takes you to different actions when reviewing content and always justifying the reason for that action. Why is that information being either retained, modified, or reviewed from the record? And what are the cost implications of that action? Chapter 5 then takes you through when you finally have your content organized or revised or confirmed, then what can we do to make sure that content is based on technical priorities and user requirements and set up and designed in a way that's, again, attractive and useful for the different users. There's always 3 questions we're going to come back to when thinking about users' needs. Do they understand the content? Do they find the content useful or valuable? And are they able to use the content to take action for improving health? We have 2 different examples from Madagascar and Nigeria about how they worked with their home-based record content. In the case of Madagascar, working with a designer during the initial redesign phases and being able to test that final design with relevant stakeholders. And another case from Nigeria, probably, I don't know how well you can see it, where they did different prototypes and tested different prototypes to finally come up for their final design. And I'm going to pass over now to my colleague Keiko, and she'll take you through implementation.
Thank you. This is Keiko. Let me talk about Chapter 6 and the implementation of the home-based record. Implementation includes the operational support processes that ensure a home-based record is available, valued, and used correctly. So in this chapter, you may find some tips for introducing a new or revised home-based record with a pilot test and addressing common implementation challenges. Next, please. If you have a plan to develop a new home-based record or to make major revisions, for example, the Ghana case, from 2 records to 1 MCH handbook, it's suggested to conduct a pilot test to learn about operational support processes, what works, what does not work, and any changes need to be made, and content or design elements, what should be adjusted prior to scale up. So pilot here means an initial implementation on a small scale across a limited number of facilities or geographical area. In planning the pilot test, you can find the activity box to identify the key questions to determine what you want to achieve and what you need to test during the pilot. Then introduce and ensure different users are familiar with and use the new or revised record. Monitoring is usually necessary more intensively than routine ones. It's worth to invest on monitoring as experiences during the pilot test can be applied to strengthening routine monitoring, as you may see in the story from Afghanistan in box 13. Next, please. So the starting from the consider how best to scale up after the pilot test, depending on the country's context, and we can use the results from the pilot test to modify the prototype of the home-based records and the operational manual to be used in all areas. Then, so some common implementation challenges have been dealt with below. As the post tells us that the common challenges we share. So the securing financing is the fundamental, not only for the design of the home-based record and the first year of printing, but for printing and the distribution over recurring 3 to 4 year periods. Funding also needs to cover other processes, including capacity building and supportive supervision activities to increase awareness and monitoring. For printing, its costs can vary widely according to the size of the home-based record, the number of pages, and the color printing versus black and white. We need to consider trade-offs and set the number of printings to get a realistic unit price. As Lola mentioned before, supply chains of home-based record are often poorly monitored. So let's monitor, then address issues. Integration of the home-based records into existing supply chains, as well as the strengthening skills of health workers in stock management have been found as realistic solutions. There are many reasons why health workers do not correctly fill in a home-based record or properly explain health promotion messages in a home-based record. The training sessions followed by supportive supervision are effective to strengthen health workers' skills in using the home-based record. Pre-service professional trainings and accreditation systems by professional bodies also opportunities for us. Users' guides are often developed to increase the accurate data recording, correct clinical assessment based on the recorded data and the referral, and health education to women, parents, and caregivers. You may need a strategy to ensure that users are aware of the home-based record, its purpose, how to use it, and why it is valuable to them. The orientation to women, parents, and caregivers are needed to home-based records values through ensuring health workers to remind them to bring their home-based record to all health visits. As there is often a lack of coordination across different programs that have content in the home-based records though, the MNH programs, immunization, nutrition, health promotion. The strengthening skills of managers or the core team to work effectively across programs, make changes that's reported. Next, please. The template on defining specific actions for operational support processes may help you to design and prioritize the actions to take. Activity and boxes may give you ideas of the actions. As this is a living document, we expect your suggestions to update this one. Thanks. That's my part for the chapter 6.
Okay, we're almost at the end, but we cannot complete our program cycle without monitoring, which is addressed in chapter 7. And it's really important to understand if the use of the home-based record and the operational support mechanisms are functioning as planned to ensure optimal implementation and optimal use of home-based records and to ensure continual improvement. So this is what chapter 7 focuses on. Next slide, please. And in order to be able to monitor, it's important to set milestones on what you want to monitor and what you want to achieve. And for this, we went back to the 8 key success factors that were introduced earlier today and gave some examples for high-level milestones around high-level coordination and support, about content, about the printing and distribution, about budgets, etc. Next slide. So after defining milestones, it's important to also have some indicators that really give hard data on some context-specific priorities. And we don't suggest to have a lot of indicators. We know there are many demands to programs, but to select 1 or 2 key indicators that can be output indicators and help to routinely and systematically monitor some key priorities. It's important to select the methods and instruments that you want to use for monitoring. What are the existing tools where information is either already included or can be included, and how do you make this actionable? So what is the process for reporting and reviewing the monitoring outcomes, and then ensure that the results from the monitoring are really feeding directly into the program management cycle for planning and for decision making. There's one nice and practical example from Ghana, where a monitoring effort was completed following the introduction of the new home-based record, where teams went out across 10 different regions and did monitoring both on the use and availability of home-based records, but also on some best practices on how it was used that then was used to actually share that with other regions, with other facilities. Next slide. If you have good monitoring in place, this might not even be needed, but sometimes it might be useful to do a situation analysis of the current status of the implementation and also the content of your home-based records, and that is addressed earlier in the guide in chapter 3. This up-to-date information that you can get through either very good monitoring or a thorough situation analysis will help to inform planning. It will help to gain support. It will help to identify which of the support processes need to be strengthened, but also to really discuss and review whether the home-based record in the form that you have meets the needs of all three user groups. Next slide, please. So the situation analysis is really three parts. So it's important first to understand the use by the three different user groups. And again, as throughout the guide, there are practical templates and also some examples where these are pre-filled on how you can use them. So first, to look at all the different user groups, what works, what doesn't work, and what are some actions that can be taken to improve. Then understand the performance of the operational support processes. Again, go through all the different processes and see what are the enablers, what are the barriers, what needs to be changed. And then there has to be a process of prioritization. Not everything you will be able to address at once, but what are some quick, easy wins, fixes with high impact that you should be implementing right away? What is important but requires a little bit more planning and is a high impact but longer term investment? And then what are the lower impact changes that you can be doing, which you can be doing either quickly or which again require a longer term process that the coordination group needs to engage in. For this, it's really important to go back to your overall coordination mechanism for home-based records. It's important to include all relevant programs that have content in the record and really do this as a multi-sector, multi-program effort to have a thorough situation analysis and then planning effort. Next slide. So this was the run through, very fast, all chapters of the guide. The guide has one annex, which describes a little bit more in detail the methods on how it was developed and the contributors, of which there were many, and many of you are on this call to the guide. But there are three web annexes on the side where the guide lives. And these web annexes include the templates that can be printed for activities that are included in the guide. It includes sample interview guides for the different user groups, as well as some monitoring supervision checklists that you can adapt for your use and context. Next slide. We just wanted to re-emphasize, and you all know this is not a tool that stands alone. The home-based records are one tool that is an integral part, and it's important as part of the tools that support the overall health and well-being of women, children, and adolescents. And we put a link here to some of the documents that really provide the bigger framing under which this guide is nicely placed. It supports a life course approach for programming for women, children, and adolescents. It's a record that provides valuable information for all the different user groups. Now, as next steps, and this is what we would like to discuss with you and hear from you, how can you use this guide? We think it's an opportunity, or we hope it's an opportunity for you to really come together at country level and convene your core actors that are involved in the implementation and the use of home-based records and see where are you, where in the cycle are you, where do you have issues, what of the tools and suggestions in the guide might be helpful to your needs. So you can use it for a structured review of your content of your records. You can identify priorities for improvement and use the guides and the tools to help you with the processes that you want to engage in. With that, I think, Annie, I'm handing it back to you now.
It is back to me. Thank you so much, colleagues. We tried to get through as much as possible in a short period. Just wanted to say that please, when you start to look at the guide, as you start to use the guide, provide feedback to us. We've included in the guide and here on this slide an email address you can write to. But we assume you'll have many learnings for us. We intend to work closely with countries over the next 2 years and hope to update it based on country feedback and from users' experience. So we'd be pleased to hear from you. just wanted to say thank you to so many people who were involved in this. I want to call out to Nina Gerlach, who I think is online, who is a consultant and really supported us through all of this. But you can see the different groups, including the Ghana Health Service, the Ministry of Health in Indonesia, the Ministry of Health and Population of Nepal, and all the different participants in the review meeting. Thank you. And to Tala Ramal and Sita for helping us in this dissemination. We'd like to invite now Catherine Aduasade just to give us a few words. Again, you've heard a lot about the Ghana experience in the different slides, and we thought maybe Catherine could share with us how she thinks this implementation guide could be useful to Ghana. So Catherine, over to you.
Thank you very much, Annie, and hello everybody. Greetings from Ghana. I think the team in Ghana is very excited. We just wished this guide had come a bit earlier because it would have addressed some of the challenges we had in the development of our record book. But it's not too late. I think there are very good lessons that we are drawing from this guide, and we're excited to use it as a country. One of the challenges we've had in our implementation is the coordination mechanisms among stakeholders. We struggled to develop content for this book because everybody wanted their content in there. And looking at what the guide has provided now, the templates for content prioritization, we believe that that will help us in our review process for the book. Again, with the coordination mechanisms, we've had challenges where right after a bulk printing, a program manager would walk up to you and say, oh, I have changed this particular content in the book. And so then what is in the book currently doesn't apply. And so we're hoping that with we'll draw lessons from this implementation guide in terms of how we can coordinate all stakeholders and have them on board even before we do any bulk printing, so that when they have updates, we'll be able to do that. I think another area where we've struggled as a country was the budget and planning. We were so much into the printing of the books. And I think for some of the areas in terms of the operational processes, we didn't really have budget lines for that. And that also has impacted the rollout of the book because we've had challenges with printing bulk amounts. Again, from the Ghana workshop that we had, we've been able to now look at how we can streamline our eligibility criteria in terms of distributing the books. I think in the past, we had dwelt on providing the books to all people who did not have, including the backlog that we had as a country. But now we have streamlined it to look at giving it only at the antenatal so that pregnant women would receive, and then it would cover the children up to 5 years. And that has helped us address our stockout issues as well. So that is also another area that we think that the guide can help us. We are excited about the templates, the different templates that the guide provides for us, including the monitoring and evaluation template as well. And we are happy to include it in our existing materials. At some point in Ghana, because of the challenges we're facing in our implementation, we came up with a management guide, which was also to address some of the problems at the management level. But looking at this guide, I think there are areas where we didn't include that we are happy to include as a country. So overall, I think Ghana is excited to use the implementation guide. We've already seen the results of using it. Like I said, we've streamlined our eligibility criteria, and now we have enough books. We've also been able to advocate for the NHIA to come on board, our National Health Insurance to come on board. They are printing for us. Currently, we have our birth and death registry also printing some of the books for us because they have also included some of their aspects in the book. So on the whole, we are excited to use the book, and definitely we will share our feedback as we use the guide. Thank you very much, and over.
Thanks so much, Catherine. That was really great to hear. We really, Catherine was a great collaborator, and the experience in Ghana, I think, can be of a lot of interest to other countries. There's lots of questions, and there was even one in the chat about what is more effective. Ghana did their work to determine you know, what was better for their context, singular cards or the combined handbook. And again, they've had a lot of learnings, and Catherine has been really helpful to us in being able to capture some of them and sharing them. But I'm sure she'd be happy if any of you wanted to reach out to her and ask questions. We have some questions in the chat. Tala, I'm looking to see, do we have time to answer some of these?
Yes, definitely, we do.
Definitely. Okay, well, I'm really glad then. So Laura, I'm going to ask you a question. I know you collect this information in the joint reporting form about financing and cross-program financing. Now, Laura's going to tell us about the joint reporting form that not cross-program necessarily, but that talks about different institutions. One of the things we do promote in the guide, though, that there is cross-program financing. Anybody who wants to put content in the home-based record, what is their financial contribution to making sure that content can be printed and reviewed? But Laura, do you want to say anything about findings from joint reporting form?
Yeah, thanks, Annie. I think that the issue of financing is always something that comes up, particularly in countries who have issues with stock out of home-based records. So in the joint reporting form, the financing aspect relates to immunization. So just to be clear that that's what is being reported from the immunization perspective, but it really depends on how the structures within that country actually allocate funding for home-based records. So even though this is the immunization program reporting on financing, sometimes we might see that overall the Ministry of Health is responsible for printing, whereas in some countries it's the immunization program responsible for printing. And then when we find out, we ask an additional question like, who are others responsible for financing? Sometimes donors contribute towards financing home-based records, when ideally there should be a line within the budget at the country in the Ministry of Health budget for printing of home-based records. But clearly this is something that is not happening in many countries, because we see that the issue around financing is quite problematic. And when it comes to a certain point in the year where they may be facing stock out of home-based records, they request support from donors. So it's within the guide, I think it's quite clear that we want to ensure that countries consider strongly how they want to finance the home-based record. And I think, you know, in the chat, you could see that, you know, different countries have different types of home-based records. Some countries have simple trifold 3 pages cards that have immunization and maybe growth monitoring, while as other countries have much more comprehensive home-based records, which are more costly to finance and print. So all these considerations should be taken into account, but I think the financing aspect in different countries, you know, is very dependent on the level of, I suppose, communication and awareness that is put towards the home-based record and how that can be financed going forward. But I think it's a very important document. I want to re-emphasize that again. We know that it can really help with health outcomes, and from the immunization perspective in particular, you know, we know that this document is used during coverage surveys. It's also used as a reminder for caregivers to know when to go back to the health facility for their next immunizations. But also for other health areas, you know, there's an importance on this, and hopefully going forward, greater emphasis will be put on other programs to reuse this as a monitoring tool also.
Thank you, Laura. Keiko, do you want to answer this question about who should be responsible for monitoring? Is this a district level function, a national level function, and who in the ministry? Is it the EPI program? Is it MCH? Is it nutrition? Any thoughts on that, Keiko?
Thank you for the question. So the monitoring issues and what is the reality in the field. So the monitoring that could be done at the district levels, and also the annual review meetings. So at the national level could be used the part of the monitoring. It's not necessarily go to the field, but also the getting the information there together and they review together at the national review meeting is another way. So there's some some mixture or the combination of the field visit and reporting and the sharing is the design of the monitoring. So I guess it's very interesting which the Lola mentioned about the co-financing for the availability of the MSH handbook, the home-based records, and also the monitoring could be used across the programs. So over.
Thank you, Keiko. There are several questions relating to monitoring. It seems to be of great interest to the group. Laura, there's a question about monitoring to benchmark progress linked to any initiatives, for example, the Immunization Agenda 2030.
No, it's a topic that I think we really wanted to emphasize in this guide, because what we've learned is that the monitoring aspect is not very strong in many countries. I think we could agree in that. And I think the fact that we have the WHO and UNICEF joint reporting forum, that's one of the tools that we have available, evidence that we have for kind of ongoing monitoring of home-based records globally. But within a country, are countries aware of how well their home-based record is functioning? Do they know how much of the home-based record is actually used by the user groups? Do they know health workers understand every aspect of the home-based record? Do they know the availability of home-based records? So these are all information that are captured. We know that's through the joint reporting form, but also through some of the surveys, such as the demographic health surveys and the multi-cluster surveys that are done by UNICEF. These are some information that we have available, but at a country level, ongoing monitoring, this is an area that I think could greatly improve implementation of home-based records if there was an increased awareness about how well they were being used and the availability and retention going forward. But in terms of initiatives, as part of the Immunization Agenda 2030 is the global agenda for immunization for the next decade. And just to say that within there are 4 strategic priority areas, or there's 7 strategic priority areas, but the 4th one is life course integration. And home-based records is a key area in that, because life course is an area that is expanding, and we know that previously, particularly for immunization, vaccinations were provided for mostly women who were pregnant and children, but now we're seeing the vaccinations are being provided across the whole life course. So considerations on how you can record and report that across the life course are considerations that we're taking into account. But in terms of monitoring, we'll see ongoing, if there's going to be future work being done in countries, if this idea around strengthening monitoring will be something that could be improved upon or started in some instances to try and improve ideas around how we can see how well the home-based record is being implemented.
Thanks, Laura. I'm going to take a question from Svetlana about studies of caregiver use. I wrote it in the chat, but again, we did do for the guideline a qualitative evidence synthesis of stakeholders' perspectives. So this brings together globally an idea, but what you'll see in the guide that we're really promoting is that these kinds of studies, this kind of knowledge about how stakeholders feel about the messages, how they perceive the messages, what do they find most useful. This has to be done in each context, and this is something any manager who is working with home-based records needs to know. So that was a really good question. There are several questions about digitalization, and I'm just going to say a few things, and then I want to hand one question over to my colleague Anne. We did a review to capture what kinds of experiences there are with digitalization of home-based records. We never have a conversation without someone saying, shouldn't they be digitalized? What we've learned is that there are a few experiences, but it's usually small scale, and countries struggle for different reasons, either related to digital and digital infrastructure, again, related to information in the home-based record, but most efforts are small scale. While digitalization of home-based record in itself is interesting, what we learned from work we've had in a recent WHO consultation, and I believe one of the colleagues in his comments, and I'm sorry, I can't scroll to find it, hit the nail on the head. Really, the most important part is strengthening health information system. How do these digital home-based records link to that? How does a home-based record linked to that health information system. And it's the very same scenario for digitalization. We see that some of the countries and where they've been most successful in what you can call a digital personal health record has been when they have electronic health records or registries, and the public or people are allowed to can access the information in their record. That is probably seems to be a very effective and sustainable and scalable form of making sure people have access to their records, and that these records are able to go with them as they do care seeking in different places. So I hope that answered your question. And I wanted to bring to you this question from Eddie Nakamura about how can we promote government leadership and promote funding so that there's adequate financing of home-based records.
Thanks, Annie. I think one thing is what we keep emphasizing, the need to really bring everyone together that wants to use the home-based record as a tool, and then really think about what are the contributions and what are then also the contributions in terms of resources to making the home-based records work. So are there opportunities for cost sharing? Who can cover, which parts of the budget that is required? Where does the funding come from? In which budgets is it included? Is it financed at the national level? Or I think from Ghana, actually, there are some good examples of discussing on how financing can be brought down to the sub-national level. But I think the most important thing is the recognition of the importance of the home-based records and its value in achieving improved health and well-being outcomes, and then really proactively thinking across all the different programs that have a stake in the records on how to do it. And then what are the funding mechanisms, including domestic, but also donor funding mechanisms that can be used for that, right? There is the immunization agenda and Gavi funding. There's the GFF investment cases. Is that included in there? Are there opportunities to include it in that? What about from the nutrition side? So I think there's that's the main thinking that has to take place.
Anne, did you want to say something else about digitalization?
No, I didn't. Thanks, Annie.
Okay, thank you. I just want to flag in the chat some of the questions because there was one question from Mary Kadiatu Koroma regarding emergencies. And I see one colleague from UNRWA wrote a comment, and I think there's some excellent experiences that could be shared about in emergency settings, in refugee settings that UNRWA has. Unfortunately, maybe not on this. We don't have time. I see we're coming to an end. But I think there are documented that can be shared. And so anyone, Akito, if you're on the line, if you can share some links, I think that would be really helpful. I'm just strolling through the questions to see what we've missed and what we can pick up on. Laura, did you see case studies? Okay, one is about case studies on cost effectiveness. Maybe the JICA colleagues, Keiko or Maki, if you want to add to this. When we did the home-based record recommendation, that means the guidance that led to the recommendations, we did try to look at cost effectiveness studies, and there really wasn't much information available. So there's some costing information available, very context specific, but there weren't good studies on cost effectiveness. Keiko, I don't know if you want to say anything more related to that.
Annie, thank you. For the cost effectiveness, that's one area that the WHO recommendation missed the information because it's very much context-wise, the information we just have some countries' cases. So, but at least we have some items and then which is essential to be implemented for the implementation, and also the items which should be in the other budget line we need to identify and we need to promote it so that not for only for the global partners to invest on that, but the country themselves try to convince the Ministry of the Finances to think about the home-based record is a part of the essential service provision. So that we need the tool to ensure that the continuum care is to be provided for every mother and child. And the MNH, the home-based record is a good monitoring tool and also the empowerment tool. Why not if the government invest on the vials for the immunization with why not with the home-based records? This kind of the advocacy is needed, and for that purpose, we need to have the list up the items that which is needed for. But again, so we must be careful enough how to measure the impact and to collect as much as possible information. So far, the JICA side provided some information to WHO when you developed the WHO guidelines. But beyond that, we still have the less information. So we welcome the participants today. There may be a good peer and to get work together for the information and the evidence, the advocacy information generation. Thank you.
Okay, I'm going to take one. I'm just going to make one last question. Thank you, Keiko. And then Tala is going to share with us a video that Laura Shimp from JSI has prepared. There's a question from Beletu about, do we have plans to implement in other African countries? In fact, Beletu, this is what we're hoping is that there are many home-based records in different countries of Africa and different parts of the world. Again, that's a country decision about do they want to implement a home-based record and what type of home-based record. What we're hoping is that this guide will be of use to any country who is either thinking about starting or revising their home-based record, or who is thinking about making changes to their home-based record. And we think the guide can help them to systematically think out the important information they need to plan the content, test the content, and make sure the record meets their users' needs and their program objective needs. Tala, should I pass over to you now so we can see the video?
Yes, definitely.
Hi, thanks for your interest in home-based records. I'm Laura Shimp. I work at John Snow Incorporated, where over many years we've been emphasizing the importance of home-based records for immunization programs, but also across maternal and child health programming. And wanted to talk to you a little bit briefly about the importance of this guidance that's just come out and our role with this with World Health Organization. This is part of a package of several resources that have been available, including guidance on recommendations for home-based records and work that was done on immunization records, which we featured in some work that we had done around really trying to understand the home-based record users and actions associated with these users from the public health administration perspective, health worker and community health worker perspectives, as well as with parents and caregivers. And as you see in this graphic, there's actions and activities associated with each of these users that all come together to really make the use and longevity of home-based records as a reporting tool and a health record so important for families and clients. We based some of that analysis several years ago on missed opportunities for vaccination, where, as you see in this guidance, there were challenges even with home-based records being available. And then, of course, there's the use and the continuous importance of these documents as reporting tools. And you see here that in some cases it's associated with vaccination, but in many cases they're not aware of the importance of it, or it hasn't been requested for use during sessions. So the importance of this new guidance coming from WHO is really to strengthen this ability to utilize this guidance in the future and make sure that it's stopped, that it's available as a reporting tool, and that all the programs that have content in the card are using the card and ensuring it's updating, as well as the data quality and communications around this card as an important tool for the health program and for the clients who are using it. we had done 4-country learning related to immunization use of home-based records a few years ago. And what the countries came back telling us was it's so important to reinforce the communications on the home-based record with mobilizers and caregivers, also to reduce those missed opportunities, to verify card availability, involve caregivers in understanding the schedule, including identification of newborns, to be sure that they receive the cards and that mothers and caregivers know how to use them, and that there's interaction with community health workers. Also, the really important issue of ensuring the supply and resourcing financing for these cards or programs. Version control is very important also, and this new guidance from WHO really helps to explain what needs to be in that content and to really make sure that that content is assured by the programs and that it's realistic so that the printing, dissemination, and cost of the cards will also be manageable by the ministries of health and the health programs over the long term. And then, of course, we want to make sure that those cards are available in all settings, particularly in urban, rural, remote, and fragile settings where supply may sometimes be more challenging, or where we have a large population and we need to make sure that they have access and use of those cards. And they're also compared with registers and facility guidance as well as community registers, so that there is a dialogue and emphasis on the importance of these home-based records as part of other health reporting and trend analysis, as well as guarding and safeguarding these records as important tracking tools for the health program, but also for the caregivers long term, for example, to have records for child vaccination during school entry. So I'll wrap up here just to note that here are some additional resources that complement the WHO guidance around designs that worked, the importance of data triangulation that I described, and then, of course, what do we need to do really with integrated records and identifying the situation that will make it conducive for these records to be available long term. That is really explained in the guidance that has just come out from WHO across health programs. So thank you for your interest in this, and please let us know how you're using this guidance. Thanks so much.
Okay, I think we've come to the end of this session. We just wanted to, on behalf of the WHO, UNICEF, JICA team, and thank all of you for joining. This session was organized by the Quality of Care Network and by the Child Health Task Force, and we're really grateful to them for allowing us this opportunity to share with you. You've given us such wonderful questions, and we're going to keep all of them and go through them. This will help us in our work with countries and with others and sharing the information. Again, on behalf of the team, thanks to all of you for joining. Tala, I don't know if you have any last words you'd like to say.
Thank you very much, Annie. Thank you everyone for joining. And yes, that's it from me.
Okay.
Thank you. We will be sharing the recording of the slide deck with everyone after the webinar via email. And these will be also posted on the Quality of Care Network website that also will be shared by the Child Health Task Force. So thank you everyone for joining us today, and have a great rest of the day, great evening. Thank you.
Thank you.